I'm losing fat, looking very aged for my age. Even though I'm in mid 40s, like, I'm looking more like in my late 50s. So yes, so this buccal fat is not because of the protein loss or lack of protein intake. It is because sometimes some people lose more weight on a particular area. Okay, so for example, see the buccinator, this muscle out here, it's not a huge muscle like this muscle, which can deplete and cause you a major difference. But yeah, the fat in this area, when it goes, it gives you more of a inward appearance. So yes, that does add on to your aging.
And in the process of weight loss, is this buccal fat is the first to go or the last to go?
Doc, very honestly, if you ask me, I would say it's very subjective. And it is very race subjective, not subjective person wise.
I see.
Like I seen in Caucasians is very different. In Europeans is very different. I've seen it very different in Indians. So if you're now being an Indian myself from Mumbai, if you ask me, what I would look at it is when I see my fellow counterparts, okay, males or females, irrespective, I see them first losing the under eye area. The first thing which goes, including me, what happened was the under eye starts moving out. So now you'll be like, but when I lost weight, it was here, why over here? So that's why I said it is very race specific.
I see.
Okay. So some people are more on your under eyes, some people are more out here. But if you ask me, what I see is under eyes move out first.
Okay.
Then next thing what you see is this thing starts coming downwards. And because of that, you'll start seeing everything moving in the front out here. So basically with gravity, when we lose the fat, with gravity, everything starts migrating in the front. That's why you see the bunching happening out here and the lines getting more prominent.
Wow.
So it is very specific person to person or race to race. It is not always
It's not always. Okay.
Yes,
okay.
no.
Some people feel like, whenever I lose weight, the first thing that is being shown is on my face. Some people say that, the last thing
Yes.
that is being lost is my buccal fat. In this Ozempic and Mounjaro era, there is this typical name to this face is called zombie faces.
Ozempic face, yes.
Right?
Yes, doc.
Ozempic faces.
Yes.
Right? So just to bring the audience to attention, Ozempic and Mounjaro is a weight loss medication which is really potent, where it will give you like 15 to 20% of your weight loss. It doesn't matter whether you are meeting your protein intake or not.
Very true. Very true. Doc.
It will give you weight loss. The fact of the matter is that we have to make sure that the lifestyle goes along with Ozempic and Mounjaro.
Yes.
In my practice, I've seen 75% of patients, they don't do it. Okay, that is why they are going on Ozempic and Mounjaro. But the biggest problem that I'm facing is that they lose weight, but they have these phases where buccal fat is gone, under eye fat is gone. What is your thoughts on that?
I'll just come to the first point of Mounjaro, Ozempic, and you mentioned about Ozempic faces and zombie faces. So now anything you have, okay, there's going to be an effect and a side effect.
Mm-hmm.
Okay. So when you say an effect and a side effect, as human beings, we always first jump on a side effect. We see the negatives first. That's how we are mentally trained. Okay. Very rarely you'll see somebody who's like seeing the positives. We highlight more of the negatives. And like you rightly mentioned, the negative is a Mounjaro face or Ozempic face. So first thing your tummy goes, your butts go, your thighs go, chest, everything goes. And by the time you realize my face is also gone, it's too late. And I'll tell you why also, doc. The reason is, now see, you are seeing your face every day in the mirror. It doesn't make a difference to you because you are seeing it every day. So you're like, okay, fine, it's normal. Only when somebody points it out to you, like, dude, what's happened to you? Or when you see your pictures, like your old picture and a new picture, and you compare, like, hey, yaar, I'm looking very different suddenly. That's when it hits you like, oh damn, something has gone wrong out here. Okay. So yes. So these things do happen. Now, anything you consume, including a paracetamol or antibiotic, everything has an effect and a side effect. So same out here also. The only thing is, since the new drug, a new molecule, a lot more things have to be structured as far as the way it is given and the way it is also accepted by the patient and what is to be done in the future. So if you ask me, doc, I would think like educating the patients is much, much more important, which should be done to begin with. So yes, then the chances of seeing a Ozempic face or a zombie face is not like it'll be negative or zero. It'll be much lesser, according to me. Now, even though that happens, because it is going to happen eventually, whether you take Mounjaro or you just do a crash dieting, you're going to lose your weight any which ways. You're going to have that zombie face any which ways. That's where interventional dermatology comes in. So many patients who come to me, they're like, doc, we don't want fillers. Okay. We don't want to do anything inside our face. Give us something to eat. So I'm like, okay, fine. To each his own. Perfectly
Something
justified.
to eat what? Eat
like give
tablets?
me a good protein supplement or give me something which I'll put on weight, my face will look better. Give me some
I see.
exercises. So many people come and say like, I'll do face yoga, usse acha ho jayega. So I tell them ki boss, yoga was not built for the face, it was built for the body. Okay. So your face is meant to express.
Is there something called face yoga?
Oh yes, doc. It is a big thing.
Seriously?
Yeah. Now everybody creates something and this makes it a trend. So that's how we all are. We just like to hear trends and then follow trends and then say वो काम नहीं करता है. क्यों काम नहीं करता है हम लोग को सोचने का नहीं है ना. We don't want to think. We just have that herd mentality.
The face yoga is because to
Strengthen
the
what
muscle.
exactly is propagated as face yoga, according to me, is it improves your muscle tone, increases the lymphatic drainage, reduces the facial swelling, so it makes your face look more tauter. But honestly, is it possible? You have to carry a dumbbell to build up a bicep. Just by emoting and expressing, if your muscles get strong, then there was no need for anything, right? You'd be like perfectly toned. I would have perfect tone on my face. I would do it every day.
I see.
So yeah, there are a lot of misconceptions. Okay, so to each his own, like I said.
Right.
So when you say face, so when you talk about face, yes, coming to interventional, when you have these things on your face, what happens is you lose a lot of collagen. The main ingredient in a body which supports our structure is collagen. Easy to hear. Everybody speaks collagen. So some people are like, we don't want to go interventional, we'll apply collagen creams. So there are multiple ways of looking at it. But honestly, when you lose a structure, if your pillar is gone of the building, you cannot put something like a mud piece and just say, okay, fine, it'll support. You have to substantiate with a pillar itself or a pillar-like object. That's where your fillers come in place or biostimulators come in place which stimulate collagen.
Wow.